Now, over the last couple of weeks, Kenyans have been advised on how to avoid getting COVID-19, and we can't stress this enough. Hand washing, personal hygiene, and social distancing as well. But what happens if you actually get the coronavirus? Well, right now, that's what we want to delve into on Newsnight with two medical experts. Some of the questions we want to talk to them about include what sort of treatment are coronavirus patients getting? Why are people suddenly around the world buying chloroquine? Joining us now is Dr. Loice Ombajo. She is the head of infectious diseases at the Kenyatta National Hospital. She is not in our studio because of social distancing, and I trust that she can hear me loud and clear. Dr. Ombajo, thank you for speaking with us tonight. Let me read some questions that are quite similar, sent by some of our viewers on 22422. One viewer is asking, they say corona has no cure. Why is it that we hear that people who are recovering from it? Please enlighten us on it. We are confused. And Kevin Lucas from Nakuru says, hi Wahiga, what medicine has been used to cure the over 100,000 patients worldwide since we are told there is no cure? Dr. Ombajo, that's where I want to begin. No cure, but people are getting better. Help Kenyans understand how that happens.
Thank you, Wahiga. Thank you for having me on the show. So, as has been indicated rightly by many people, that we don't have cure at this point. But the thing with many infections, viruses included, is that your own immunity begins to fight the infection, so that with the time you develop what we call antibodies, that's sort of a response to this virus. And you also have cells that attack these viruses. And with time, your body begins to get rid of the virus.
Okay, you've tried to really quite simplify it. But then let me ask you the same question in a different way. It has been confirmed that person X has the coronavirus. What are the next steps if a medical team is treating them?
So once we confirm that someone has a virus, the treatment really is based on how severe the presentation is. So if someone has mild disease, they may have maybe a fever, they may have maybe a cough or maybe some sore throat, then what we do is, one, give you something to control the fever. So, for example, you can be given Panadol, which is a common drug that we use for lowering fever. And the other thing is really just supporting someone, making sure they're able to feed, that they don't get dry or dehydrated. So that's for mild disease. Many people may not even require treatment. If someone has more severe disease, and so they're having trouble breathing.
And please help us understand when someone can then be classified as severe. Go ahead.
So severe would mean that, you are a little sicker in the simplest way, but you may have trouble breathing. You may have a lot of chest pain, very severe cough. But the main thing is that the oxygen in your blood is not enough. So for us as doctors, that's what we'd use to define that it is severe. So if someone has severe disease, that's someone who requires some oxygen to, to help oxygenate the blood a little better. Then we'd also require maybe to treat them for other things that may make the pneumonia worse or the chest infection worse. So they may get some antibiotics for any other, say, concomitant infections, so to say. On the other end of the spectrum is where someone has very, very severe disease and they may require to be taken care of in ICU. And maybe this is a point to say that from the experience we've seen from other countries, most people tend to have mild disease. A small percentage of people are the ones who may end up with severe or even critical illness.
Dr. Ombajo, I'm guessing there are some who may be tempted after this interview to rush to the nearest pharmacy, stock up on as much Panadol, paracetamol as they can, your cough medicine. Is that something you would advise?
Not necessarily. I think we have to be careful about some things. One, every drug has side effects. So don't start popping Panadol all the time. Panadol can damage your liver if taken too much. So every drug should only be taken if there's an indication for the same. So if someone has high fever that's not coming down, then in such a case, we could consider giving them Panadol. But if it's a mild fever, not making them too uncomfortable, then you don't need to take the Panadol.
Okay. On a related note, there are those watching the broadcast tonight who know that they have what would be termed as existing medical conditions. Some have had asthma in the past, or other conditions as well. What would you advise them today, even as we know that the new coronavirus is quite contagious? And maybe where we should begin is, what existing medical conditions would you be concerned about as a doctor?
So thanks for asking that question. We've received a lot of that as well. So again, we are learning from the experience that other countries have had. And so far, it seems that people who have heart disease, who have high blood pressure or hypertension, or who may have diabetes, seem to be more likely to have very severe disease. If someone has had chronic lung disease, so you're talking about asthma, or people who've been smoking for a long time and have damaged the lung, then again, the likelihood of having more severe diseases is higher. The other group of patients for which we've had a lot of questions is the context of HIV. And at this point, we don't have a lot of data about HIV. But what we know is that for patients who are on treatment, and the immunity comes up because the virus is down, then they're at lower risk of getting severe disease. However, if someone is not on treatment, then there may be chance of getting severe disease. Of course, if someone has other reasons for their immunity to be suppressed, maybe they're on chemotherapy, or they're taking drugs that suppress immunity for the purpose of treating certain diseases, then they may have more severe disease.
What would you advise?
So in terms of what advice to give...
Yes.
Yes. So in terms of what advice to give to someone who may be predisposed to getting more severe disease, is that this is the time when you want to really adhere to the directives that have been given. So one, you want to make sure you stay home, avoid unnecessary travel, avoid crowds, reduce the number of visitors you get into your home, adhere to the hygiene measures you talked about earlier, the hand washing, avoiding touching your face, keeping your environments clean would be very, very important. But stay home. The other group that I didn't talk about is the elderly. So again, people above the age of 60 have been shown to have severe disease. So this is a time when we need to protect the elderly people in our society. Let them stay home. And for those younger people who live with them, avoid going out to crowds so that you reduce the possibility of bringing infection to the older people at home.
We are getting lots of questions from our viewers, and I'll get into one or two of them shortly. But related to that question now, does boosting one's immunity help, and how much can it really help, and what can one do, especially for those cases that you've mentioned? You've told them to avoid crowds, etc. But are there foods or types of medicines that they can take that can assist them at a time like this? So
the simple answer is no.
Wow. Okay.
But in terms of keeping ourselves healthy, we need to do the things we know we should do. So eat healthy, exercise, reduce stress, those are the things that really should help. There's no particular medicine that you can take to improve immunity. And I know this is a time that a lot of people are stocking up on loads of vitamins and other such things.
Yes.
They're probably not really useful. They're not useful if you don't have a deficiency of those things. Yeah. So if you're able to eat a healthy diet, then that's what you should do.
So what you're trying to say in many words is that a lot of the people now who've stocked up on vitamin C, etc., and are taking them religiously daily are not really adding value to their health. Is it safe to say that, especially if they don't have that deficiency?
Yes, it's safe to say that. We should be very careful about what we take into our bodies, Many times some of the several supplements you take, you're not clear what quantities of various things they have, and some may end up being more harmful than useful. So have a healthy diet, drink plenty of water, exercise, the usual things we're told we should do to stay healthy.
Okay. We're trying to get on Dr. Loice Ombajo as well, and I'll let our viewers know as soon as that has happened. Let me ask you one more question before I pick some tweets. A viewer has asked, why, help us understand, in the context of COVID-19, why are some people dying, and how and why are others recovering, especially for something that has no cure?
So it goes back to what we talked about earlier. The rate at which we recover depends on how well our immune system, our immune system is the system in place in our bodies to help fight infections. So it really depends on how well our immune system can fight disease. But then again, with every infection, people sort of respond differently. Some people tend to get more severe disease than others. So, as we'd said earlier, there are certain conditions that may predispose someone to more severe disease. And sometimes you really can't predict from the outset who will get severe disease and who won't. So it depends on how our bodies respond and mount an immune response to this virus.
Okay, thank you for answering that. The questions are coming in thick and fast. First one here from a viewer, they're asking, tell us about the regular flu. How can one differentiate? And also, if someone self-quarantines for 2 weeks, what next? Do you just leave the house after that and go on with your normal life? And for someone who has recovered from COVID-19, is there any possibility that they can still spread that? So let's break that up first. Let's talk about the common flu. How can you tell the difference? And if you have the common flu and you stay indoors for 2 weeks, after that, should you feel free to leave the house?
So many of these viral infections tend to cause very similar clinical presentations. So if someone has flu, again, they may have some fever, they may have a cough, they may present with sore throat or a running nose, very similar to what you may see with COVID. From the clinical presentations we've seen from other countries, it seems the most common presentations would be fever and cough. But a few other people may have muscle pains, maybe some difficulty breathing, or a sore throat. So just at the outset, it's very difficult to separate these two. At this point, what we'd say is that if someone has those symptoms and either they have traveled or they've had contact with someone who's traveled or has had disease, then we should be concerned about the possibility of COVID-19.
But if they have not, then they should treat that as a common cold and hopefully just stay at home, make sure they're over with it, and then, get back to their lives, we assume. Let's look at Twitter now, Dr.
So I guess that...
Go ahead. Go ahead, Dr.
So if someone has had quarantine for 14 days and during this period they've not had any symptoms, and they've not had fever, they've not had cough, then it means that that period of quarantine is over. But for most people who are currently in quarantine, even after the end of quarantine, we're still asking everybody else to stay home. So they should follow what everyone else is doing and still stay home for this period, even for their own safety. So
even after the 14 days are over, don't go out and start living your normal life. Everyone is being encouraged to stay at home or social distance. Okay, let's put up that tweet. This is the first one, Dr. I'll read it for you. JB Baraka is asking, what's the fate of patient 1 and the other batch of first cases in Kenya? How are they responding to treatment? Have they recovered? We need to know. Dr. I don't know if you are in the right place to answer that one. If not, let me also add another one here. Caleb Misat is asking, do we have ARV drugs or prescribed ARV drugs against coronavirus? And what is the definitive treatment currently being given to the already confirmed cases? Okay. Let's see if we have another one. All right. There's so many on Twitter right now, but we'll try and take as many as we can. TJ Verenes is asking, Wahiga, 1, can the virus spread via food? For instance, fruits and other raw consumables that have been touched by a positive individual. Number 2, can cooking kill the virus in food, high heat? And number 3, how well should we clean food prior to consumption to cap the health risk of this contagious contaminant? Okay, all right. Do we have any more tweets? All right, we have another one. This one is coming in from Lillian. She says, I'd like to know if it's true that chloroquine is a treatment for COVID-19. Very interesting one. We know that demand for chloroquine, hydrochloroquine as well, has also gone up. And Kendi is asking, can someone transmit coronavirus if they test negative, but they have the virus? If so, after how long since the date of infection? Okay. Doctor, I don't know if you got as many of those as were asked.
Yes.
Okay, go ahead. Give us your responses.
Yes, I got them. Okay, so I guess the first question was about antiretrovirals and COVID. So I think this question probably comes up because in the initial stages, there was some suggestion that there are certain antivirals that may kill the virus. So most antiretrovirals have sort of what we say broad spectrum. You know, they can act on multiple viruses. And that was the initial thinking about whether they could kill COVID. But I think over time, the observations have sort of shown that they may not work.
Okay.
The other question was definitive treatment.
Yes.
So again, as I said, at this point, we don't have a definitive treatment. There are a number of clinical trials. And what happens with clinical trials is you have a group of patients who are given a drug and maybe another group of patients who don't receive the drug, and you observe the two and see whether one group does better than the other. So there are a lot of clinical trials going on now, and we'll have to wait to see if they show results about whether one drug is effective.
Oh, okay. Someone was asking about food. Can someone touch some food and then it's transmitted to someone else? What about when you cook the food in high heat? Go ahead.
So one, if I touched an apple and I had COVID-19 and maybe I had the germs in my hand and somebody else ate it, then yes, they may get the virus. So the advice here is that we wash all our fruits and vegetables thoroughly before consuming them. And in terms of cooking, yes, high heat would kill the virus. So it's important, especially for meats and such things, that we cook our food thoroughly, especially meats, for example. So high heat will kill the virus and cooking will kill the virus.
Okay. I want to ask you to pause there. I know there was a question on chloroquine, but I want to bring in somebody else who I think can help us address that. Dr. Please stay on the line because I now want to introduce Dr. Loice Ombajo, the president of the Pharmaceutical Society of Kenya. Dr. Loice, thank you for speaking with us this evening. Your society issued a warning, a press release, warning Kenyans against hoarding chloroquine, hydrochloroquine, and azithromycin. I hope I've pronounced those correctly. Let me first begin by understanding and help our viewers understand what is the link between these drugs and COVID-19. Why would some Kenyans or people around the world be looking for these drugs?
Thank you, Aiga. I think that was Dr. Wala. Hi, Dr. Wala. For me, what we started seeing was a spike in public running to get the medicine. That was after the president, Donald Trump, went ahead and said he feels that combination is the best for the country. That's the US. So I think it's just speculation at the moment. There are no, like Dr. Wala said, phase 3 trials haven't happened. We don't know how the patient will react, or even how the virus will react. So for now, I'd say speculation. Yeah, but the medicines are there in the country.
There's a lot of echo.
Our warning was more so for, it had two parts, yeah? Okay. The first part was people were holding the medication, hence denying legitimate patients the said medication. So we have patients on rheumatoid arthritis who use the same medication, chloroquine, and they were not finding it in the shelves. Yeah, so that was a bit unfair for us to go and hold that. Two, it was just letting the public know, because we've seen cases in the States, Nigeria, where people are just now, taking them as prophylaxis, like not prophylaxis, they're just taking it in anticipation, self-diagnosing and taking the medication. So what we have seen adverse reactions. Actually, I think today there was a report of a death. Yeah.
Yes, in Arizona, that's correct.
These two medications. Yeah, these two medications have a very narrow therapeutic index. Yeah, that means the highest dose where it's safe and the lowest dose where it's efficacious, where it can work, it's very narrow. Yeah. So you can't just go ahead and start using them in combination and at home, self-managing yourself. You actually need a team of a physician, a pharmacist, and nurses to be there by your bedside and seeing you through that process.
You're right. And that this actually should be prescription medicine. So tell me this. Tomorrow when somebody logs onto the internet looking for solutions to the new coronavirus, they will see this article that Europe has begun clinical trials of experimental drugs to treat COVID-19 in thousands of patients. And one of the drugs being looked at is chloroquine. Someone might then think, why don't I get this chloroquine in advance just in case it is helpful? What are the dangers of self-medicating with something like chloroquine, Dr. Mashogu?
Yeah, I mean, we live in an age of you can't dictate what people are going to see on the internet. Yeah, right from I mean, there may be even remedies on how to cure COVID. Yeah, but this particular one for chloroquine is actually very. We should take it seriously because, like I said, chloroquine at the worst can actually cause heart complications. Yeah, you don't want to congest our already stretched health facilities with something that you went and got yourself into that you could actually have prevented yourself, from getting into. So, if I think we need to just follow the 5 things that. Are being perpetrated across the country, across the globe. The public health matters. Yeah.
Yes.
Are you spacing yourself? Are you as you go to the supermarket? Are you making sure you are using sanitizers? You are not touching your face and all those things. Yeah. So that we can prevent. So we don't want people to self-medicate. We have health workers in this country.
Okay.
We're actually working as a team. We are being coordinated nationally. And even at the county level, as Dr. Wala would have mentioned earlier. And the important thing is you need to let us do our job, Don't go self-medicating and now we have to manage your heart. Yet we need those machines and the ventilators to manage.
Oh, it's very unfortunate. He was giving a very important message. Don't self-medicate. You'll overwhelm the public health system. Dr. Mashogu, I'm told we can now get you. Let me ask you the final question before I go back to Dr. Ombajo. Okay, Dr. Mashogu, can you hear us? He seems to be adjusting. Okay,
I can.
You can hear me. Final question to you, and this was a question I was hoping to pose to the Pharmacy and Poisons Board, but they are not able to join us this evening. We are hearing of other countries that are testing for vaccines. Clinical trials are ongoing. Once they are proven to have worked, Dr. Mashogu, how long do you think it would take for Kenya to onboard? What does the law say about how long it takes for us to accept a vaccine for use locally?
I mean, this wouldn't be a strange thing to Kenya. I mean, it happened when we had new medication for HIV training. So we have qualified and competent people at the Pharmacy and Poisons Board who will be able to. I mean, the whole country is fast tracking. So desperate measures call for desperate solutions, and I know for a fact that the Pharmacy and Poisons Board will not be a stumbling block. They'll actually facilitate, Kenyans accessing any of this medication. And if indeed even chloroquine is found to be of use to this particular fight, of course, the country would fast track that. And we actually have leaders in the said institutions who will be able to fast track that process.
Dr. Mashogu, thank you so much. Let me go back to Dr. Ombajo, seeing lots of questions also coming in for her. Daktari, someone is asking here, kindly answer this question. If a person has been sick with the new coronavirus and recovered, can they become sick again? We have family members who work as medics. What measures have been put in place to mitigate the risk of taking that disease home? Dr. Ombajo, 2 questions for you. Okay, we seem to have lost her on that one. Dr. Ombajo, can you hear me? Have you had those 2 questions? Okay, I don't seem to be able to get through to her. Dr. Ombajo, a viewer is asking, 1, if you become sick with the coronavirus and you recover, can you become sick again? And secondly, what happens if you have family members who are working as medics and they take it home? What more can be done to keep people safe? we seem to have a problem reaching out to her. Maybe Dr. Mashogo, we carry on with you. I trust you can hear me. It seems that your key message is don't stock medication. Some might be tempted to stock antibiotics, etc. You're saying tonight, don't do that. Seek a doctor's opinion in case you're inclined to do so.
Yeah, so you actually meant to go see your pharmacist. We have referral structures now where you can be taken to a physician, or you just go to the clinic, the hospital, yeah? Once you present with any of those symptoms, then you'll be able to be triaged, moved to and referred to the center where you need to be, once testing has been done and you have whatever can't be managed at that level. But I think the issue around, so there's a lot of selfishness, and I think the CS Health talked about this indiscipline, where, for example, we are finding even health workers coming to work. It's a big issue because fares are being increased. We are meant to be at home, or rather off work and leave the essential services running so that we can try and contain this thing as fast as possible. Yeah. And my appeal, someone was asking about health workers. Of course, they are at risk. Yeah. They also have loved ones. So, of course, even they have children who are off school. So they have to do that double shift. Yeah? Yes. But their procedures of decontamination before you come home, and because the most we can do right now is try to limit that infection. Yeah. And, of course, if they do test positive, the same measures also apply to their family members. Yeah. So instead of panicking, how can we support them to be able to, as they come home, how that decontamination? Are there family and friends who can take care of the children while our healthcare workers are on the front line taking this fight? I think we need to work as a society, sort of as a community, to be able to support each other. Yeah. Public transport, can we stop hogging the public transport? Because I'm hearing people saying, can taxes be reduced on fuel so that matatus can reduce the fare? I would rather the fare stay high, yeah, so that we have less traffic on the roads, so that health workers need to get to at the moment. Because I think what we're trying to say is limit movement. Limit movement. Okay. And that, yeah, limit. Because then we're able to contain. If it's in Kilifi, we contain it to Kilifi. Then the healthcare structures can be able to manage those numbers that are coming in.
Let me ask you to pause there, because we now have Dr. Ombajo on the line. Daktari, I trust you can hear me now, and you can nod if so. Good. Okay. 2 questions. Someone was asking, if a person has been sick with the new coronavirus and they have recovered, can they become sick again? And also the risk to family members of medics who are currently working on the front line.
Okay, thanks. So in terms of being sick again after recovery, I think we're still learning a few lessons around this virus. We don't know everything around it yet. What we have is experience, especially from the Chinese context, where they told us that there are very few patients who, after discharge, seem to show some virus again. But it was a minority of patients, and it was probably because they'd never fully recovered in the first place. But majority of the patients who recovered were able to go home without any issues. The issue of whether you get immunity to the virus, that means that, again, if you're exposed to the virus, you won't get it again. I think we'll probably know that as time goes on. It's probably too soon to tell whether people will get reinfection again, because this is really new, so to speak. In terms of healthcare workers are at risk. And I guess our constant appeal to government and to whoever has the ability to support the issue of making sure all healthcare workers have appropriate and sufficient protective gear, so that even as they're on the front line, they are themselves protected. If a healthcare worker gets exposed without that protection, then they can get disease just like any other Kenyan. It is so important that our healthcare workers don't get sick, because if they're exposed or get sick, it means they're withdrawn from work. They can't work anymore. And that will reduce the people available to take care of the rest of Kenyans. if a healthcare worker is sufficiently protected,
yes,
then they can go home to their families.
How
However,
then,
if they're exposed,
sorry for interrupting you,
the risk of taking disease to their families is there. Sure.
Yes. How then can their families, one, support them and at the same time manage the fear, you know, their family members back at home, as more headlines come out about the new coronavirus, also get worried that our loved one could bring the virus to us. So how do they find that balance, those providing support to the medics at home?
Okay, so one, I think it's for the initial responsibility lies with the medic to make sure you don't get exposed. When they come home, one, it's to let them be a part of the family and enjoy being with the family, because that psychological support is so important when you've had many hours of hard work where you're also knowing you're putting your life at risk. If at any time we feel you've been exposed, then one, it would either be that the healthcare worker stays away and doesn't go home until the period of quarantine is over, so that there's no risk to the family. And I guess it would be a call to families and other relatives to really just stand with them and support them, understand if there are times when they're not able to go home because of this, and of course keep praying for us.
Okay, let me give some final 3 questions. We have so many questions, but our time is pretty much up. We have a viewer called, and this is to you, Dr. Loice and Dr. Louis. Brian Okoth is asking, is it guaranteed that one must get the virus if they come into contact with a positive carrier? And what happens if for those who get into contact with a positive carrier and don't get the virus? That's one question. We have another that we want to put up on the screen. This one is from Kibet Kuwait. You're asking, will someone get COVID-19 through a cut or a wound? How long does the virus stay in someone's body? And one last one, this one via SMS. Someone is asking, they're from a children's home, what can children eat to boost their immunity? This is from Susan Orr. Okay, let's start with you, Dr. Loice, and then I'll give Dr. Louis the final word.
Okay, so maybe we'll start with, is it guaranteed that everyone who gets exposed gets disease? No, but we don't know how much exposure guarantees infection. So I think that's a question that we may not have a very good answer to, because we're also still learning a bit more about this virus. But we can't say that definitely if you touch you'll get, but at the same time we can't guarantee that if you touch something and put in your face that you won't get disease. There's a question about whether you can get it from a cut or a wound.
Yes.
So viruses depend on certain receptors. So our cells have certain things that recognize viruses. So some of these things that we're calling receptors lie within the mucous membranes, which means the virus is more likely it will enter through the mucous membranes, not through the skin or through the hair or through other parts of the body. And the mucous membranes are those that line the eyes, the nose, and the mouth.
Okay. And the last one about children and immunity for parents who might be concerned this evening?
So for children, again, it's the same thing. We want your children to have a balanced diet, to get adequate rest, and to get some exercise. So allow them to play in the house or in the compound, within confined compounds. You don't want children in groups outside of the house playing together, so that you also reduce risk of transmission. So allow them to play in the house. Ask them to get adequate sleep and make sure they get a balanced diet.
Okay. Thank you for that. Dr. Louis, which of those, I can give you a chance to tackle some of those questions?
Yeah, a lot of those questions are public health, primary health sort of information, and it's like particularly you can actually access, there's a WhatsApp group for WHO. You know, can I get it from a cat? You know, all those information, you're able to get it from there. You know, the myths and mythbusters. I think citizen can actually share that number. It's actually a WhatsApp group. You just click on the link, you enter, and you're able to get any queries that you need on myths that we keep hearing. But particularly, there's another question that was asked around immunity and what do people have to go take. I'm sure if today I said a particular medicine for boosting immunity, tomorrow, of course, it will be out of stock. The important thing is, I mean, we are living healthily, as Dr. has said, exercising and what you need to do just to stay healthy. Yeah.
Okay, he wound up and he seemingly left. I think it's a technical challenge. Dr. Loice, as we finish, I know I've said finally, but this is the real finally now for you, Dr. Loice. Someone is asking, will all COVID-19 cases develop a fever? Yes or no?
No, not everybody develops a fever. The experience we've seen from other countries is just about 60% of people will develop a fever. The rest may never develop a fever at all. They may develop any of the other symptoms that have been talked about. So it's not that you must have fever and cough and all this. It could be any one or any combination of those symptoms.
Okay, thank you so much. We've had on the line with us Dr. Loice Ombajo. She's the head of infectious diseases at the Kenyatta National Hospital, also working as a lecturer at the University of Nairobi. And of course, Dr. Louis Mashogu, who is the president of the Pharmaceutical Society of Kenya. To both of them, I trust they can hear me. One viewer has asked, I wish the medics would consolidate everything into an FAQ, frequently asked questions document that is shareable for all Kenyans. Some advice out there to any of the medics who are watching this program. Kenyans are saying, please compile all the answers to all the questions we've been asking into a document that Kenyans can regularly share that is correct and accurate. Well, that's all the time we had today for Newsnight. I know there are more questions. I'm seeing even my phone buzzing. But of course, tomorrow, JKL and all the other shows, we have Daybreak as well. We will continue.